was 19 years old when my dad was first diagnosed with dementia. Before the disease, my dad was just the most simple man ever. He really just cared about supporting me and my mom, and he worked a lot. He was always at all of my school events, and yeah, he was just a really loving, caring dad.
After you get that diagnosis, your whole world changes. I mean, everything changes. It's not about the memory loss. That's a small part of it. We deal with a lot of psychosis. We deal with hallucinations. We deal with delusions. We deal with pacing, anxiety.
One of the hardest things that I've seen my mom go through is just how much this disease has taken from her life. She used to be so outgoing. I mean, she would hang out with her friends all the time. She would have people over all the time. But she just doesn't have any time for herself anymore.
The role of the caregiver is just profound. We underestimate the need that we have to give to the caregiver ourselves.
Caregivers are often watching the disappearance of their loved one, their spouse, their partner, their father, their mother. It's not just how exhausting it can be to provide care, and that's a big job, but emotionally it's exhausting. And I think part of our job is to help them navigate that process.
Dementia is different because it affects someone's cognition, and a caregiver really takes on the role of that disease. So they're going to come to the day where not only am I making sure they get to their doctor's appointments, but I'm making the decisions for them. And I think it's really important for not just the patient and the caregiver, but to realize they don't have to be in the disease alone.
Grieving is an everyday thing. You grieve so much. You grieve, just little things. Sitting down and watching a movie together, going out to dinner together, enjoying vacations together. We don't have, there's not going to be a future for us. Hopefully I'll have him around several more years, but, with this disease, you just don't know. I try to just take it one day at a time.
Well, our memory center is very unique because it's not just made up of physicians, but we also have other team members, psychiatry, social work, pharmacy, therapy services, and at different phases of the disease, it's not just what can the physician offer, but what else might they need.
The social support side of family needs is very complex with memory disorders. We found that the social needs were sometimes greater to better serve the patient and better serve the family.
What makes us different is that it's not just physicians or advanced practice providers delivering a diagnosis, but trying to look at how can we provide a service to the patient and caregiver-patient duo, but also how can we serve the community.
The condition starts 20 years before we know it. Well, if we can do a better job of identifying those conditions and treating them before they ever have symptoms, that's really where I want to see us get to. So this program needs to continually grow and expand.
We need support of everyone in the state of Kentucky. This is a disease that affects all age groups, not just the older patient, but it affects their families. So we have to think about everybody contributing to the cure and the eradication of this terrible disease.
We can never become comfortable until this disease is truly a thing of the past.
You cannot do this journey by yourself. You have to have a team. Dr. Cooper and Stephanie, to me, are more like family. They really are. I don't know what we would do if we didn't have them.